Hi, my name's Michelle Gellis. I am an acupuncture physician and I am the founder and president of Facial Acupuncture Classes. I would like to thank the American Acupuncture Council for this opportunity to speak to you today about microneedling for hair loss. Can we go to the first slide? So, what I'm going to talk about is the different topics I'm going to speak about today are the different types of hair loss and how microneedling is within our scope of practice of Chinese medicine, and then how it can stimulate hair growth and some protocols for microneedling the scalp. So I teach a 1 hour CEU class on this topic. So you're getting like a little snippet, but I wanted to do a nice overview for you on microneedling for hair loss. So a little bit about me. I taught at the Maryland University of Integrative Health from 2003 to 2021. And I am currently on the doctoral, I'm on faculty at the doctoral program at Yosan University. And as I mentioned, I have been teaching facial and cosmetic acupuncture classes internationally since 2005. There are many different types of hair loss. And in general terms, some are due to stress or illness. And so I'm just going to go through the like the Western medical differentiations of different types of hair loss, and then we'll talk about how we differentiate in Chinese medicine the different types of hair loss. So in Western medicine, we have male and female pattern baldness. This is androgenetic alopecia, and this is the most common form of hair loss that we see. For men, it's either right on the top here or in the front, and in some cases, both. Also, there's telogen hair loss, where large numbers of the follicles on the scalp stay in the resting phase. But so we have different phases with our hair growth. Some rests, some grows. And if we stay in the resting phase too long, your hair falls out, but then new hair doesn't grow in. And this is typically due to some sort of a hormonal imbalance, thyroid, childbirth, or a shock to the system, like a surgery, fever. We're seeing this with COVID. People lost their hair with COVID, and sometimes it is from a vitamin or a mineral deficiency. And so that's telogen, and then there's anagen, and this is from a medical treatment such as chemotherapy, where your hair just suddenly falls out. It's almost like it spontaneously falls out due to medical treatment. There can be autoimmune conditions like I'm having trouble saying it. The slides are kind of small, but that is an autoimmune condition. And tinea capitis is ringworm, which is fairly uncommon in Western society, but it does happen. And then there's scarring alopecia, and there's several different categories of this. There can also be hair shaft abnormalities and hypotrichinosis, which is another type of hair loss. In TCM, we divide sudden hair loss into 4 categories, and that would be sudden hair loss due to blood heat and wind. And we see this more commonly in adolescents that are tending towards, because adolescents tend towards blood heat, which is going to generate wind. And the signs and symptoms might be some itching, right? Irritation from the heat. There might be a headache. The tongue is going to be red with a thin coating, and the pulse is thin and wiry and rapid, as with any heat condition. And so the treatment is to clear the heat and the wind. And we can also have sudden hair loss with a qi and blood deficiency pattern. This would be after a sudden illness or postpartum because of qi and blood cannot ascend up to the hair. And so the treatment for that will be to tonify the qi and blood. Also, we can have gradual hair loss due to damp heat. Typically, this is from dietary type conditions. People have damp heat from eating a diet that would generate that in the body. And the scalp would be greasy and sticky, and you might get some itching, and the hair could fall out in clusters. The tongue is going to be red with a greasy coat, and the pulse will be slippery and rapid. And the treatment would be to clear the dampness and the heat. We can also have a gradual hair loss due to a liver and kidney deficiency pattern. And we see this most likely in middle age. And so this would be the kidney deficiency type of hair loss that is most common, and that would lead to some of the male and female pattern baldness that we would see. And the hair will be dull, sometimes yellowish, white, and they will have typical kidney deficiency patterns like a sore back, knees, dizziness, and red tongue. The pulse is going to be thin and rapid, and the treatment would be to nourish the liver and the kidneys. Another reason for hair loss in Chinese medicine would be mental and emotional disorders such as stress, grief, and worry, which can cause the hair to thin and fall out. When we're thinking about microneedling in Chinese medicine, we tend to think of microneedling as something that is more of a modern technique, but the Chinese have used needles to beautify the skin for thousands of years. And in Chinese practice, it's referred to as Mei Rong, which translates to beautiful appearance. And so using needles to rejuvenate the skin has been used for thousands of years. And although the tools that they used and the terminology was slightly different, microneedling, which is also known as collagen induction therapy, is almost identical to what we might do with a 7-star hammer, or even when we're stimulating our channels with a channel roller, surrounding the dragon to treat scars, and But using a microneedle derma roller or a derma pen, and I brought one with me today for you to see. So this is a AccuLift micro pen. There are many manufacturers of microneedle pens, but these devices, you turn them on, and they have different speeds that you can set the pen at. And then there's a guide right here, and let's see, I got to go in the right direction. Up, and as you can see, as I twist the um, the little dial, the needles, these little needles, where am I? Come out. You can see the little needles there. And when the pen is on, they vibrate up and down like this, and they penetrate the skin. So when we're using acupuncture to reduce hair loss or to increase hair growth, using a microneedle pen or a derma roller helps to reduce the inflammation that might exist in the hair follicle. It also increases the flow of blood to the skin and to the hair follicles, which allows any nutrients that are in your blood to go out to the surface, and it helps to stimulate hair growth. Acupuncture, full body acupuncture, will help to reduce some of the stress, which, as we saw, is one of the causes for hair loss. And acupuncture enhances your immune system. So if part of the reason that your hair is falling out is because of an immune deficiency or something that's stressing your immune system, doing full body acupuncture along with microneedling can help balance the hormones, enhance your blood flow, enhance your immune system, and allow your hair to naturally grow. So, this little picture of what it, like a cross section of what it looks like when the needles go in. So what does microneedling actually do? Well, it does two things. One, it stimulates your body's own collagen production, and hair is made out of collagen and elastin. And it also opens the skin up. So when you do microneedling, it should be done very superficially. It should not be done very deep. There shouldn't be any bleeding. And it allows for the absorption of any products that you put on your skin. So if you're using some sort of a hair growth stimulating product and you put it on your scalp, our scalps are pretty thick and it can be difficult for the product to get in. But if you put the product on and then you do the microneedling, it allows it to go down past the outer layer of your scalp and get into where the blood supply is and allows the product to be picked up by your skin. Here's a few photos. There have been a lot of studies done, and I'm not going to go through all of them. I do have a few references, and there's a bunch on my website. So AccuLift has a website, and on the website there's information about microneedling and different studies that have been done on microneedling. But this is just some pictures, before and after pictures for microneedling that were done by a company that makes microneedle pens. As I mentioned, I'm not going to read through all of this, but clinical studies that have been done on microneedling and showing how much more effective microneedling was than even using minoxidil, which is currently known, commonly known as Rogaine, and some other studies that were done showing the body points that were used in conjunction with the microneedle pen. And so you can flip through these, as I mentioned, on the website. And the protocol is that you would clean your patient's scalp with either an alcohol spray or some witch hazel. You would let that dry. You can put numbing cream on the scalp and then put a shower cap on it because the heat will help it to absorb. And you definitely want to use numbing cream because microneedling, the scalp can be very sensitive. If you've ever like pulled just like one hair, you know how sensitive our scalps can be. Once the cap is on with the numbing cream, if you have an LED, one of those LED lights, you can set that on blue, and that helps to kill any bacteria. And then you would insert any body points that you were going to use to treat the different conditions that we spoke about. You would wait about 15 minutes, you come back in, you wipe off the numbing cream, and then you put whatever serum you're going to use. Aculift does make a hair serum, and uh, before you would use any prescription serums, I would strongly recommend contacting a medical professional. The hair serum that I use on my patients that I sell is all organic and vegan and very few ingredients, but it's all very good, even just on its own, to help with hair regrowth. And you don't need to set the pen needles too long. So usually what I'll do is I set it at like 0.25 or 0.5, and then you work from the hairline back. You can either go in a linear direction or you can use a stamping. So you can either stamp or you can work straight back. It really depends on how much hair they have. Let's say it was someone like myself, their hair is thinning a little bit, like maybe right here, and you just wanted to kind of get in there and help to stimulate. You would be better off doing a stamping motion than trying to run the pen. But even if you're doing a stamping motion, you start at the hairline and you work your way back. And after you've done that, if you have an LED light, you can put it on red, leave it on there for about 5 to 10 minutes to allow the serum to really penetrate and for the blood flow to increase. And then you would take out your body points and you're done. I always sell some serum to my patients and tell them to use it twice a day. And I've had some really great success with myself and with my patients. Trying to, this spot on me right here, I had lost a lot of hair during COVID. I don't know if I was pulling my hair out of my head or what, but had started some hair thinning in that area, and it's pretty much all grown back now, which is great. So the serum that I'm talking about, can you pull my slide up? This bottle looks a little larger. The bottle itself is, I think it's 2 ounces, but it's like a very easily absorbed light oily serum, and that's a picture of the pen. And just real quick, the courses that I offer, I have a facial acupuncture basic certification. I also teach facial cupping and gua sha, derma rolling, and skincare, microneedling. I teach a 2-part course on treating neuromuscular facial conditions. I am a classically trained Worsley 5-element acupuncturist, so I have a course, a 2-part course on the anatomy of expressions, about our emotions and how our emotions can affect our appearance and vice versa. Also, facial acupuncture self-care for acupuncturists. I have an advanced techniques course for those stubborn to treat conditions. I also have a safety course, and I've just added an ethics course so you can meet your safety and ethics requirements. And I also have a comprehensive advanced certificate class, which is self-paced with monthly optional Zoom meetings that we do. And there's also a live hands-on component. I do travel, as I mentioned, internationally teaching hands-on classes. So you ever get a chance, get on my website, facialacupunctureclasses.com. And I am available on Facebook. I have a Facebook group for questions and answers. And should we open it up for questions here? Or if anyone has any questions now, I'm happy to take them. I cannot see the chat window though. Okay, so next time, the American Acupuncture Council will be hosting Pony Chang, and that will be on Friday. So thank you again to AAC for this opportunity, and I hope you found this beneficial.